So with regard to your style of like
Yes.
grading and whatnot, have you ever, and not to say it for the future, but have you ever implemented like, let's say, all of the questions and answers to the test are like one letter?
That's a good question. All right, so let me repeat what Jay just said. Have I ever been such an evil teacher
Yes.
that I made an entire 40-question multiple choice exam all one letter, like B for every single answer? The answer is no. The reason is I feel that is counterproductive. At that point, I am purposefully trying to psych you out, and now you are fighting against the exam structure rather than against the actual material I want you to learn.
But
So I will not do that.
wouldn't it be like really messy? Like, cause a lot of my high school teachers did this, and they would say like, oh, well, if you knew the information, you wouldn't be second guessing yourself.
I don't believe in that.
Okay.
I don't believe
That's
that.
like human nature, is like guess
You would, yeah, you would be surprised.
Now, I will say that ExamSoft randomizes the answers. I do have it set to randomize answers on my exams. So, is it possible that it randomly causes 6 questions in a row to have the answer of B? Yes, that is possible. Okay, so don't take what I just said as it will never happen. It's unlikely to happen, but it may happen. But I won't purposefully do it, okay? I will not purposefully do that. All right, and so that kind of brings us to today's topic, which is critical thinking. Okay, critical thinking and problem solving are very, very important, both in a didactic setting and, or even more importantly, in a clinical setting. Because in lab, when we practice in lab, when we do positioning in lab, you are working with what we call an ideal patient, your partner. Your partner knows everything that you know. They know what you want to do. So they are going to be the most cooperative patient you will ever have. When you go into the clinical setting, patients are not going to be like that. You need critical thinking skills, you need problem solving skills in order to get your patient into the position you need to get the images for the doctors. So you need to find ways to work around your patient. So what are the steps to critical thinking? First, we need to identify the problem. You can't solve the problem if you don't know what problem you have. Secondly, examine the problem. Figure out what information you have about the problem. Third, consider viable solutions. How can we solve this problem? And then fourth, select and enact the best solution. Of your choices, which one is the best for your situation, and then do that choice. Now, when selecting the best solution, you do need to keep ethics and morals in mind when making your choice. For example, if my issue is the patient keeps wiggling on the bed when they lay down, I need them to stay still for an x-ray. Well, okay, I'm identifying the problem. Patient is moving. Examine the problem. Okay, so what's going into here? Well, the patient's moving because they're uncomfortable, the bed is hard, I'm taking a long time to set up for this x-ray, they may have a bed sore, right? Bunch of issues that may be playing into this problem. And then I need to think of some solutions. What is the best way? How can I keep this patient from moving? How can I keep this patient from moving ever again? What if I choke and suffocate them to death? That way they won't move. No, you can't do that, right? That's not ethical, that's not moral. So you can't just choose the best solution. It needs to fall within an ethical and moral framework. Right? So, in that case, all right, well, we can't kill our patient. We can't sedate the patient because you need a doctor's order. What else can we do? All right, so we can try and make the patient comfortable. We can try and speed up the exam. Or we can try an alternative position. They can't lay on their back. Could we possibly do this with the patient on their stomach instead? Instead of supine, can we do the patient probe? Different ways to approach the problem. And then looking at these options, choose the best one for the situation at hand, and then try it out. Okay, so, like I just said, in lab, you practice on your partners. These are your perfect patients. You will never see a perfect patient in clinic unless you happen to get an X-ray tech as one of your patients. And in that situation, half the time they'll be your perfect patient, half the time they'll try and mess with you. Okay, so keep that in mind. Each patient is unique. That means each patient has their own circumstances that you need to think about. So decisions about their care requires critical thinking skills. You need to understand the why, right? You need to understand the why in order to make decisions. Okay? And there will not always be a single right answer. There will be many good competing answers. And you just need to choose the one that you feel is best for the situation based on your criteria at hand. That best situation or that best solution for one patient may not be the best solution for a different patient. So it all depends on your situation. Right, so once again, number one, identify the problem. What are you trying to solve? Number two, investigate the problem. What are the facts? Who, what, when, where, why, how, right? Your 5 W's and your how. Formulate solutions. So come up with multiple solutions. Okay? Make sure that these solutions are based on your professional knowledge, ethics, and standards. And then finally, select the best solution out of the ones that you came up with. After you try out your solution, look back at it and ask yourself, did that work out the way I wanted it to? Was this actually the best solution? How, or did something unexpected maybe occur? Now, we also have affective critical thinking. The word affective refers to caused by emotions. So this is critical thinking related to emotions, right? Analyzing personal values and feelings. Feelings, right? So your own feelings, you can express these through journal writing, or you can discuss them with your faculty, your supervisors, or even other students, as long as you maintain patient confidentiality, right? So make sure you do it by HIPAA. Often when dealing with the patient or family, communicating during challenging situations, working as part of the healthcare team, you need to be able to use affective critical thinking skills, right? If you can't just, let's say there is an accident in the X-ray department. Let's say a patient fell off the X-ray table, and now you need to explain to the family what happened. Right? So you need effective critical thinking, so you want to explain it, but you want to keep their feelings in mind, right? But you also want to make sure that you are being honest and forthright. So you don't want to be like, oh, well, I just rolled out the table, LOL. Right? Haha, how silly of him, right? Because, right, that's rude, right? You don't want to do that, okay? So you want to be able to express emotions professionally. I know a student who says that they deal with all emotional situations by giggling. Sometimes that works. Sometimes that doesn't. And there needs to be a different solution, right? Once again, if you try and bring bad news to a family member of the patient and you're giggling to get through the emotions, that's not a good look. So you need different ways to do things. Okay? This is also used to manage personal problems, your own personal problems, to keep them from affecting patient care. One of the things we say is that any issues that you have at home, those stop when you walk through the hospital door. As soon as you walk through the hospital door, anything going on in your life outside needs to be left there. When you go in, when you're dealing with your patients, they need to be getting the best version of you. It can't be a you that is focused on an argument with their family member from last night, right? It can't be the you who is mad at their kid for driving the car without permission. It can't be the you who is still mourning the death of a dog, right? All of those emotions are real, right? But you can't bring them into the hospital with you and let that affect your patient care. Okay, so effective critical thinking will help you deal with that. Okay. Critical thinking applies to ethics. It applies to your technical skills. It applies to patient care. So, a lot of times, ethical dilemmas, ethical situations will arise. And you need critical thinking to help navigate that maze to figure out what is the ethical solution in this situation. Technical skills. When you have your non-perfect patients, you need to use critical thinking to figure out how can I manipulate things around to get that perfect image still. Patient care. When your patient can't do certain things, you need to use your critical thinking skills to figure out how can I best handle this patient or get them where they need to be. For example, right, things like patient transfer require critical thinking skills. How do I get the patient on and off my x-ray table safely and comfortably? To help you guide yourself through some of these issues, we do have the ARRT Code of Ethics. I am not going to read this whole thing, but do look over it. A lot of this is somewhat common sense. It's sort of what you expect from a code of ethics. Am I going to ask you which one is Code of Ethics number 7? No, I will not. Right? But I will ask you, I may ask you questions related to the Code of Ethics, which you may need as a guideline in order to answer properly. Does that make sense? So I'm not going to ask you like word for word, what is this, what is that, what is that. Right? But for example, you have something simple like we're not going to discriminate based on age, race, color, creed, religion, national origin, things like that. Right? So if you ever run into a situation or a question which asks about that, and one of the answers is a bit discriminatory, you know that likely is not going to be correct because that goes against the Code of Ethics. Okay? All right, so let's look at a situation. For example, what if, and by the way, these situations are in your book as well. So if you want, later on you can look in your book to see ways that they suggest handling this. So let's say you have a patient who does not understand English. Right? You need to escort this patient from the waiting room. Give her instructions for the procedure. These instructions include removing all clothing from the waist up and any metallic objects from the chest and abdomen area. You then need to take this patient into the examination room and place her in the correct position for the procedure. After completing the procedure, you need to give the patient exit information, what to do next now that their procedure is done. So, in this situation, let's try to apply those critical thinking skills. What is the problem?
Language barrier.
Great, there is a language barrier. You do not speak the same language as this patient. Okay, so what are some of the facts about this case? Let's examine this problem. What kind of information do we need to know?
What language to speak.
Okay, great. What language do they speak? What else would we want to know?
Her name.
Okay, her name, sure.
If they have a family or like if they have somebody with them.
Great. Do they have family or friends or somebody with them here at the hospital who might be able to help? Anything else we might want to know?
Does the hospital have an interpreter that speaks that language?
Great. Does the hospital have an interpreter that speaks the same language? All right. So once we get these facts, once we get this information, now we need to start coming up with solutions. So what are some possible solutions to this problem? All right. So we might need an interpreter, either their friends or
Family or-
family, or an official interpreter from the hospital, right? If you had to choose, which one would you prefer?
The family.
So,
The interpreter.
Interpreter from the families.
so friends and family would be easy. It would be fast, correct? But can you verify how accurate that friend or family member will be? No, you cannot. So if you do need to give official information, the best thing to do would be to go through an official interpreter, correct? All right, great. So we looked at those two competing solutions. We're going to go with our official interpreter. Okay, so we'll call them up, and then we will have them help translate for us or help interpret for us as we go through the procedure. Does that make sense?
So is it possible to get both? Maybe have the family and the interpreter also when it's trying to explain the patient, that maybe the family can help.
Mhm.
Is
So
that-
yes, there are
or
some
not?
situations where you might end up using friends and family. Right? Oftentimes these will be in situations where, okay, sorry, let me back up.
Patients are too
So
old or too young?
officially, you should always be using a hospital interpreter for any official business. Now, if all you need is to tell the patient, breathe in and hold your breath, right? That's the only thing you need to tell the patient. Do you need an interpreter for that? Probably not. Right? If they have friends and family, you can probably get them to tell them to do that. You can watch to make sure they're obeying or complying, and you won't need to wait for the actual interpreter. Right? But if you're going to give them instructions like, no, now that you're done with the X-ray, or you need to go, you'll get a call from your doctor in 3 to 5 days. Okay, so just go home and wait. Okay, now you probably want an interpreter because now you're giving them official information as to follow-up care. Okay. So it does kind of depend on the situation. Yes, Emily.
What if, like, I don't know, whenever I go to the doctor with my grandma, I'm the one that they talk to and they're talking to me.
Yes.
So what if that's the case and you don't need the translator, you're talking to somebody? Do you still get the interpreter just in case?
So best practice is to use an interpreter if they are available. Now, does everyone follow best practice? No, I'll admit that they do not. Right? Even when I was a tech, I'll admit that I did not always find an interpreter when I perhaps should have. I would use friends and family to try and convey information. Okay. A lot of what I said was just, well, we're going to be doing an X-ray. This is the X-ray. Breathe in, breathe out. Okay, you're done. I'm sending you back to the nurse. But if I was going to do anything more than that, I would probably wait for an interpreter. That would be the best thing to do. For example, something you will do is you will have procedures where the patient will need to sign a consent form. In that case, right, the patient needs to sign the consent form. That sort of situation, I would definitely make sure to have an interpreter, because that's the only way I can make sure that the patient has truly gotten the information I need them to have. If they have a bilingual family member, that's great, but once again, I can't be certain that family member is going to get across all the information I need accurately. Okay. So yeah. that is when I would use an interpreter versus a friend or family member. Okay, and same thing goes for techs in the department. Sometimes there'll be techs in the department who speak the same language as the patient. Like if I needed a Spanish speaker for anything slightly more advanced than breathe in, breathe out, I would call in a Spanish-speaking tech. If they had a Chinese patient, they would call me in to try to interpret. Once again, just for some really small things. But anything big, anything major, anything official, I would definitely go with interpretation. All right. So, number 2. Your patient is unable to stand for x-rays. Your patient has arrived from the emergency department for an abdominal series of x-rays. The history provided on their request states the patient is having a sharp abdominal pain in his abdomen. When you ask the patient if he is able to stand for the x-ray, he replies, "Yes, I'll try." So, what is the problem here?
It's already said he's unable to stand.
Right, so can the patient actually stand, right? Does not seem like the patient is able to stand very well. So let's try and figure out what facts of the case we have. What information do you want to know before we continue?
Name, date of birth.
Much pain?
All right, great, so make sure we have the correct patient first of all. Good. Okay, how long the pain's been going on? Sure.
And if the patient is well enough to stand without falling also.
Okay, so you ask the patient if they can stand without falling. Let's see, did you have
The intensity of pain?
the intensity of pain? Okay, Nancy?
Where exactly in the abdomen?
Okay, where their pain is in the abdomen, sure. Any other information you want to know from the patient or from me?
Does he have any camera?
Does the patient have family that can help out? Good.
Or any surgeries to the area?
Any surgeries to the area?
Any history of abdominal diseases?
History of abdominal diseases, okay.
And then how long, the time of the pain, how long the pain has been there? Or you've already said that?
Good. So yes, how long the pain's been going on, very good. Anything else you would want to know though about this? Not just about the patient, but maybe about the examination itself.
I'll let him know if he's, no, never mind.
Yes, Jay.
The position they would prefer, if they want to be on their back, if they want to be on their side, if they even want to be standing at all.
Okay.
What would work best for that? And then I guess we would accommodate.
Right, so in this case, I think the question is better phrased as, do we need the patient standing or do we have alternative positions that we can use instead? And I will say yes, we do have alternatives to the standing position for the abdomen. They can instead lay down on their side. That is an option. Any other questions that you
So,
may have?
Kate, I have a question that for
Yes.
any x-ray that needs to, for the abdominal x-ray that needs you to stand, you can also take that lying down on the side. Is that what?
Yes, that is correct. In fact, that was number 10 on your pub quiz. There was upright abdomen or lateral decubitus. Okay, any other questions that you have, answers that you might want to know about this? All right, so I think we covered things pretty well. So with all of that knowledge now, what sort of solutions can you envision? Yes, Cody.
Just using a different position. I'd rather, if anybody says, I'll try, I would rather me find a different position to use than have them try it.
Okay, good. So we can try that different abdominal position instead of standing. Okay, what else could we try and do?
Laying him down on his back.
Okay, so different position.
Yeah.
Anything else we could do? What if the patient said that, yes, they have a family member with them?
Get them help.
Okay, maybe the family member could help support the patient while they're standing.
But not during a test, right? Because the family member would be exposed to the whenever sort of.
Right, so then we could use that lead apron, that lead shield on the family member if we have one in the area, right? That would be something good to know. Do we have any lead shields for the family member? Along the lines of supporting the patient, one of the things we could have asked was, do we have anything that the patient could use to support themselves while they stand? Right? Do they, any devices that they can maybe hold on to while they try and stand?
Crutches, wheelchair,
Right?
things of that nature.
Right, so perhaps they could hold something else. Or they could have a family member hold it. Great. Anything else we could try?
So is it because we would rather have him stand than lie laterally? Is this because that's why we are investigating so much?
So right now we're just trying to brainstorm all possibilities. Once we have all of our ideas, then we can begin to try and narrow things down. We don't want to just throw things away immediately. We want to consider all alternatives. So instead of standing, maybe the patient could sit for the X-ray instead of laying down. Okay? Or maybe we could call the doctor and ask, is it necessary? Do we need standing X-rays, or can we just do the X-ray lying down? Okay? So, different ways to try and approach this. So, based on what we know, what do you want to try with this patient?
Because we know the image is going to be the same lying down laterally, I probably want to do it laterally. So
Okay, so we've got a vote for trying to do it laterally.
laterally.
Lay down on the side.
Maybe sitting down.
Or
Just
maybe
stand in a
sitting
chair.
down.
If he came in a chair, stay down, stay in a
Oh,
chair.
great. How did the patient come into the department? If they're already in the wheelchair, could we leave them in the wheelchair and just to take the X-rays like that, right? Minimal movement. So maybe what is the condition of the patient? Are they able to move themselves onto the table? If they are, perhaps you could do it laterally. Otherwise, maybe we want to try sitting in a wheelchair. So you've got these different competing priorities. So what if I said that, yes, the patient was able to move onto the bed, no problem. They just can't stand for a long period of time. What would you want to do now? You want to try laying down?
Then that will be the time when you'll have to do it laterally probably.
Okay, great. So you choose to lay the patient down. The only issue with that is that it takes longer to do the X-ray because you do need to set up your lateral decubitus. What does that look like? Do you remember in lab the very last position I had you put the tube in with it pointing across? Right, that's exactly what you would set up for this kind of X-ray. So just takes a little bit longer, a little bit more work on your part. Great, so that is a perfectly viable solution to this scenario.
Do we have case study like questions?
You may.
Okay. Because I when I reread the whole thing, you mentioned something about having like how they entered, and I assume that they would like walk into the facility, right? And very clearly says that they are unable to stand, so they wouldn't be able to walk. So it kind of is inferred when you're asking the patient if they're able to stand upright that they're not currently standing. So they're probably sitting or laying down or whatever the case may be. So is that what you're kind of leaning towards in the beginning when you're asking us like different ideas and whatnot?
I wasn't trying to lead you towards anything. That should have been one of the considerations. Yes.
Let's say you were to lay down your patient and then the patient falls to the floor. Like, what happens in that case? Obviously, you have to call somebody and come and help you. But I'm saying, like, as far as your license, like, is your license be able to alter or anything like that?
So here at Harris Health, what happens anytime a patient falls is that we will have to put in an incident report. Okay, and then in the incident report, we basically need to state out the facts of the case, what happened, what led to the fall, and what, if anything, was done to prevent it, or what, if anything, was not done to prevent it. Okay? And then it's basically reviewed by an incident review committee, and then Depending on the severity, they may have you do some training or they may do some other less pleasant stuff. But as a student, because you are being supervised by a technologist, you are the technologist's responsibility. Okay, so they should be with you the entire time. If they notice that anything is improper, they should step in to stop it before any adverse events happen. But yes, as a tech, is your license on the line? I'm not going to say it's not on the line, right? I won't say it's not on the line. So you do need to make sure that you are doing everything properly. And we'll talk about this near the end of the semester when we get into medical law, because we do have this concept of negligence. You did not do something which most people in your situation would have done, and by not doing that thing, you led to this event happening. You led to the patient falling off the table. And so that would be negligence. All right. Any other questions?
And that would just be based on if the call was preventable.
So lots of different factors. I'll say lots of different factors. All right, our third case study here. Is this an emergency? So you're working the night shift in the emergency department, and as your X-ray images appear on the screen, you notice that there is a gap. There is something unusual on the X-ray which should not be there. You notice that the lung is smaller than usual. And so this is potentially indicative of pathology, of a pneumothorax. Has anyone watched The Good Doctor?
Oh,
Anyone remember the very first episode where he shoves a tube in the guy from a vending machine? Right?
to release the pressure.
To release the pressure?
Oh, yeah.
Right? That pressure inside the guy's chest was a pneumothorax. A gap in between the lungs and the ribs is an indicator of a potential pneumothorax. So, right? Possible emergency situation that you see on the X-ray. A few hours later, you notice to your surprise that your patient, Mrs. Green, is in the process of being discharged from the hospital. You fear there has been a mistake and that the patient needs continued medical attention. The emergency department physician is busy with several other emergency patients, and the radiology resident is asleep. What do you do?
So Mrs. Green is asleep?
No, the resident, radiologist,
Oh, I see.
the one reading the images.
Oh, because it's a night shift.
They're asleep.
They are asleep, yes.
Wait, when up.
It's the night shift.
All right, so hold on. We're getting ahead of ourselves. We're getting ahead of ourselves. So, number one, what is the issue?
It's an,
That she has a
it
one-inch
shouldn't
gap.
be discharged.
So can you show that 1-inch gap on this
Should be
picture?
discharged.
So the issue is we think that the patient has a potential medical emergency, right? We think that there is pathology. We think there's an issue here. We think it's been overlooked. Great. So what kind of facts do you want to know about this case?
How is she doing?
All right, so how is the patient doing? Patient is still walking and talking normally.
Is anyone aware, like, you know, you would probably wanna know, like, if anybody else has seen what you have.
Great, so did the doctors actually also see that 1-inch gap? Is it something that only you see, or have the doctors been able to see it as well?
Read the report, see what they put in the report.
Great, so we can check the report, see if that's mentioned in the report or not. Good, anything else? What other information do you want to know?
Would we be able to see what kind of medications are on, and if there's anything like causing an adverse reaction or something like that, or?
Okay. So,
Or is that too much, like, on the as low as reasonably or whatever?
okay, so as far as patient's medical or like medicine information, that is most likely out of our scope of practice. Even if we knew what medicines they were on, would we have enough knowledge to know whether those medicines would cause any adverse effect related to this? Probably not. So that's probably not something we would need to know.
Could you ask another technologist?
Okay, you could ask another technologist for their opinion on the image if there's one around. Great. Okay, what else would we want to know?
See if there's another physician around available.
Okay, is there another physician available to look at the image? Okay,
So when you say ask another tech, does your supervisor gets covered in that?
sure, you could try asking your supervisor. Your supervisor is
It's also a tech,
a
right,
tech,
sir?
yes. Okay, anything else you would want to know?
Their stats, their blood pressure,
Okay,
stuff like that.
alright, so are they actually healthy? Okay, so let's just say that their vital signs look normal still. And that's the scary thing about pneumothorax, by the way, because vital signs look normal all the way up until they stop looking normal. Alright, so great. What do you want to know, right? Like whether or not we could wake up the resident.
The condition of the
I don't think
patient
I would
probably.
be able to.
Yeah, it would be something good to know, right?
First.
Or perhaps we would like to know, is there another radiology resident or another radiologist that we could contact? Okay, in addition to just another doctor, another emergency doctor. So, what kind of solutions can you come up with? Would you go and just say, oh no, Mrs. Green, don't leave yet? Is that something you can do as a technologist?
But can you ask the patient how the patient is feeling and whether she's okay to?
No, you're not near the patient right now. The patient's all the way out in the emergency waiting room. You're about 500 feet away in your own X-ray department. So if you're nowhere near the patient, you can't see the patient, but you see on the computer screen that she's going through the steps of being discharged.
Can you ask the nurse, the charge nurse?
Okay, all right. Let's see. So you can try talking to the charge nurse. Let the charge nurse know the concerns. Maybe ask the charge nurse to bring it up to the doctor.
Right,
Okay.
and kind of help her, discharge, slow it down or something.
Okay.
What do you mean by
as-
charge nurse, sir? Or
No,
nurse
as
on-
technologists. So charge nurse is basically the nurse
on
that
duty.
is in charge of that area at the time. So she's kind of coordinating all the other nurses in that area and working closely with the doctors.
Thank you.
Now, is it in our scope of practice to be able to diagnose images?
No.
No.
No. So can you tell the charge nurse the patient has a pneumothorax?
No.
No. Okay, so what could you tell the charge nurse instead? Or what could you tell the doctor instead?
There seems to be evidence of.
That you have a concern.
Yeah, or you
Please
saw,
look
you
at
saw
the
something
safety of the
that caused you,
patient. Let's see.
Alright.
gave you a cause for concern.
Great, so you phrase it in a way like, hey, I'm concerned about, or it looks like there may be, right? And then instead of maybe stating pneumothorax directly, you could instead talk about like the gap, like between the lung and the apex. So on the X-rays, I feel like I saw a gap between the lung and the apex. Do you believe that this could be an emergent concern? Yes, you don't ever want to tell the doctor what it is that they should be seeing. Right? You want to let them come to their own conclusions. Right? And the doctor says, no, it's not a concern, we're going to dismiss her. Right? In that case, then in that case, trust the doctor's judgment. But who else could we talk to?
Your charge.
Right, so instead of this emergency department physician, who else would we?
Another position?
What about the radiology resident? Right, the one who is trained to read X-rays.
Yeah.
Okay, we definitely want to check with them, and usually we have a much closer relationship to them. Okay, is it okay to wake them up?
Mm-hmm.
Yeah, of course wake them up. That's their job. I mean, they call to wake us up to go in for a call at 3 in the morning. No reason why we can't wake them up. Okay, so yeah, definitely check with the radiologists. A lot of times when we get weird stuff, the first people we go to will be the radiologists. Yes, maybe.
I was just asking, or I was just wondering if it would be okay to still document that you had saw that was something that you were concerned with. Yeah.
Yes, so I would say maybe try and contact a physician and then document that you tried to contact a physician. Yes, Jay.
If and I'm sure this wouldn't happen if something like this were to happen, but if he contacts that physician, he says that, or they say that there's no cause for concern. A couple weeks later, there was cause for concern. There's something that happens, but when you go to the person you should have, they said no. Like it's out of your hands, right? Like it's not gonna. Okay.
Right.
And that cannot be documented, right? So once you're giving it to the doctor, you're not documenting that, right?
You can document whatever you want, as long as it's true.
So would you, personally, would you go to the radiology resident or the doctor first? Who would you get first?
So I actually did have a scenario like this once myself before. In fact, I made sure it was such a nice picture that I have it saved on my computer somewhere. Don't worry about it because I have no information on this. You have no idea who this is. But you know that I was the one that took this X-ray because my initials are in there.
So first of all, what do you mean by the gap, 1 inch?
Alright, so in this case, you look over on this side, this is the patient's left lung. You notice these like fuzzy spider web looking things?
Yes, sir.
Those are the lung markings, those are the bronchioles, those are the vessels and everything, going all the way to the edge of the ribs. Over here, do you see those spider
No,
looking
it's
lines?
clearer.
Alright, so is this the lung?
There is a one.
This is not the lung. Where is the lung?
It's
This is the lung. This is the gap. This is a really big gap in this situation.
Oh,
Right? So, I took the X-ray. I sent the patient back to the emergency center. And then I took a second look at the X-ray and I'm like, this looks kind of weird, doesn't it? I think there's something here. So I go to my supervisor, the lead tech, and I'm like, hey, take a look at this image. He looks at it, he's like, I think we should call a doctor. So he phones over to the emergency doctor and he's like, hey doc, I really think you should take a look at this patient's X-rays. Okay, wait 15 minutes, I check back in the computer, and the patient is now listed, not in the waiting room, but in the critical care section of the emergency room. Right, so apparently as soon as the doctor saw the images, they sent the patient over to critical care to be looked after. Yes?
Is that a collapsed lung?
That is a collapsed lung. That is a pneumothorax. So yes, in that situation, right, we contacted the ordering physician directly. But if the ordering physician blew us off, I would have gone to the radiologist and asked them to take a look. Because if they had noticed this, then they would definitely have contacted the ordering physician themselves. Right?
So, but when you looked at it, you knew already it was a pneumothorax.
Right, so I've had enough experience to know that this is not correct. And you will learn all about stuff like this in pathology next semester. So you will be hopefully able to recognize it yourselves. Still can't diagnose yourselves, right? But at least you'll be able to recognize it yourselves.
Sir, and just one thing. When,
Yes.
when you showed us the other slide and you said they went with you the case 2, it said it has a gap of 1 inch. What gap were they talking about there?
So if these lung markings here, these spiderweb lines, did not go all the way, if it ended like right here and you saw this area that's just black, this area of emptiness, that would be your gap.
Gap of that 1 inch that you're seeing is from the it's from the side, sir.
So that one said from the apex. Apex means from the top. I can't reach the top, so that's why I'm not putting it up there.
Honestly.
But yes, apex means the very top of the lung right up here.
Oh, I see.
Right, in this case, from the apex to the lung, you have about a
6
3, 4,
inches.
5, 6, about a 10-inch gap, I would say. 9 to 10, like a 9-10 inch gap, something like that. All right. So yes, actual scenario that